Good morning and welcome to today's virtual town hall on substance use in our community post-COVID-19. My name is Ken Huvelman and I will be the moderator for today's discussion. This morning's event is being brought to you by the Substance Use Prevention, Treatment, and Recovery Work Group, which is part of the St. Clair County Community Services Coordinating Body, or the CSCB. The focus of this virtual town hall is to help you have a better grasp of how the COVID pandemic impacted substance use in St. Clair County. We will be talking with individuals from multiple areas of expertise, including individuals in long-term recovery, public health, law enforcement, and then both clinical and recovery-based services. We hope to be able to provide all of you watching today with a better understanding of substance use concerns in our community, but also to have a better sense of what is available to support those dealing with a substance use problem. Additionally, today's discussion is taking place on International Overdose Awareness Day, which is the world's largest annual campaign to end overdose, remember those without stigma, those who have died from overdose, and acknowledge the grief of the family and friends left behind. If you do have any questions for the panelists or myself, please enter those into the chat and we will try to get answers to those questions either live during this broadcast or directly through the chat. With that out of the way, let's get started with today's discussion. I would like to introduce our first panelist, Wyatt Thomas. Wyatt is a local business owner, husband, and a person in long-term recovery. Welcome, Wyatt.
Thank you, Ken.
So can you tell us a little bit about your experience of going from your days of using to recovery?
Yeah, so I was a young boy, about 8 years old, lost my mom, so my dad and I were kind of just left alone, and he was a retired police officer, so the relationship kind of was a more, friend relationship. So I kind of did what I wanted. I was kind of wild. I, left on Friday, didn't come home on Sunday, and that kind of led to high school and just hanging out with the bad crowds and the wrong people. And then that led into the getting out of high school. I actually got expelled from my one high school, moved to another one, and it's a whole bunch of legal trouble. And then the bars, when I was able to drink illegally, that just turned into a whole different deal, and met a lot of the drug dealers of the town and just hooked on and latched on to them, and it kind of went out of control for about 4 or 5 years of just drinking and drugs and this and that, working and just dwindling away to nothing. And it was a rough road. It was real rough, a real bumpy road. And then getting sober was it kind of happened so quick. One night I overdosed on fentanyl when I thought I was getting cocaine, and the dealer spiked my bag, and with about 6 minutes I overdosed and died. So 3 days later from that, I got help from a buddy of ours at the Sheriff's Department. He's now the Sheriff of Genesee County. He said, "Hey man, I got a program for you. Let's get you in it and let's do it." And at that time I had hit rock bottom. And I've tried to get sober a few times, but nobody's really ready to change unless they're ready to change. No one can do anything or say anything. It's that person's got to change. So that recovery started. I went to a 1-year faith-based recovery program where I found God and Jesus is my Lord and Savior, and it's been great ever since. There's been roads and rockies, but definitely lean into that faith that I found.
That's amazing.
Yeah.
What would you say really motivates you to maintain your recovery day to day?
Definitely my faith. Now, being a business owner, I have employees that look up to me, that I have a wife, family, but also helping people one-on-one, doing things like this. It keeps in the back, it stays in the back of my mind. So when I get those thoughts or those, that energy to go do something, or, those old memories, I think back to sitting on panels like this or sitting in front of schools and at one-on-ones with people that are struggling too. Like I want to be there, you know what I mean? I don't want to be, back at square one and redoing it,
Right. Okay.
Yeah.
So overall, how would you say kind of that COVID pandemic that happened, how would you say that really impacted your recovery path?
It was hard. You went from, face-to-face interaction to now phone calls and this and that. And like I told you earlier, the story of I had speaking gigs 5 days out of the week. And within the time pandemic hit on news, I got emails from all of my people that were hiring me that said, "Hey, we're postponing this and that. We don't know what's going on. And so I found that, and also I started kind of coaching at that time for, peer recovery and one-on-one recovery. It was a lot harder to reach people because face-to-face interaction, that's personable. Like you can't fix that over a camera or a phone. So it was difficult, but we found the loops and got over it, and was able to still help a lot of people.
Okay, that's amazing, and it's that. So I heard that story of disconnection, loneliness, and just being pulled away from peers, people.
Yeah.
So okay, what advice would you maybe have for someone who's still struggling with finding recovery?
Reach out. The internet is a big tool. There's 100 things you can look up, but reach out to a loved one or someone you know. But reaching out, I mean, it's hard to do that when you're in that state, but you got to find it. You got to find it to reach out. And I know it sounds crazy, but calling 911 and telling them, hey, I have a problem, I guarantee you're not going to arrest you. I guarantee you they're going to pick you up and take you somewhere where you need to go, because that's what they're there for. So just reaching out and being open to it.
So being open and able to say that I need help.
100%.
Okay.
Yeah.
Thank you, Wyatt. We appreciate you sharing that personal story with us. And then really congratulations on, the accomplishments you've made in your recovery journey. You said about 5 years, is it?
Yep.
Yeah, congratulations on that.
Thanks, man. Appreciate it.
Our next guest is St. Clair County Health Department's Health Director, Liz King. So welcome, Liz.
Thank you. Thank you for having me.
So living in a new post-COVID world, how have you, through the health department, seen the pandemic affect substance use within our community?
Right. So I think it's important first to reflect back, as Wyatt did, on what it was like when the pandemic started, right? Before we talk about substance use and what we've seen change, it's important to remember how vulnerable we all were, how everything was changing so rapidly. We all went from, working to being virtual. Our kids were home, the stresses that were there. Right now, it's easy to kind of forget about those things, so I think it's important to bring that back financially. Are we working? Are we not working? Are we getting our groceries? If we go to the store, are we going to get COVID? Do we mask? Do we not mask? All of those things are so important to remember in this question before we talk about how things changed with substance use. So first and foremost, we saw alcohol sales skyrocket in 2020, right? There was a 2.9% increase in alcohol sales nationally. St. Clair County is no different. That was the biggest jump in over 50 years. So there was a lot of binge drinking going on. And we know that from our community health needs assessment. I talk a lot about that. That is a county-wide behavioral risk factor survey of the adults in St. Clair County. And that binge drinking we saw increased from 2016 to 2021. We also know that vaping and e-cigarette use almost doubled as well in our adults from our CHNA. Also, 1 in 4 adolescents, we do behavioral risk factor surveys on adolescents. 1 in 4 are vaping or using e-cigarette products as well. Within that survey, we also know that 1 in 3 adults reported living with someone with alcoholism or a binge drinking problem. 1 in 4 reported living with someone with depression, anxiety, suicidal thoughts, or mental illness. And 16% reported living with someone abusing prescription drugs or illegal drugs as well. So when you look at all that information that we've seen between 2016 and 2021 in our needs assessment, you can theorize, right, that was impacted by all those stresses in 2020.
Okay, thank you. So there's been a lot of discussion in the media about the increase in deaths related to new trends in substance use. What does that look like here in St. Clair County?
Well, we know there's more of a risk factor when you use multiple substances. Here in St. Clair County and probably anywhere in the state or the nation, you use multiple substances, you're more at risk of an overdose or a death. Also, those who use synthetic opioids like fentanyl, you're at a higher risk of death. Here in St. Clair County, I have my stats here, 63% of our overdose deaths had reported using a synthetic opioid. 50%, almost 50% reported using multiple drugs before that overdose as well. In 2021, we saw a significant jump in overdose deaths. We had 65 overdose deaths reported. That was a 10% increase over 2020. And then in 2022, our preliminary ME data shows a 40% decrease, so 38 deaths. I like to think that that's attributed to organizations like Odyssey House, BW Rock, the health department, all of us putting naloxone or Narcan, that life-saving drug, out into the community or with our law enforcement officers, into schools. We've really done a big push to normalize that. I know you have as well. Reduce the stigma of carrying Narcan or naloxone. That really needs to be just a first aid tool that we have all the time, like an AED or using CPR. And we've done a great job. So between 2020, we had 420 kits distributed. And then in 2022, we were over 2,800 kits distributed throughout our county. So again, you can theorize that those numbers are down because we're actually reversing the overdoses there in the community.
Those are incredible numbers to hear that significant of a drop and then potentially have not necessarily a specific cause and effect, but
Right.
correlation. Wonderful.
Right.
So with all the data that's been collected, were there or are there still some populations more at risk?
There are at risk of COVID. So as we tie COVID back into this, definitely, I think we all learned when COVID started about the disproportionate effects of COVID-19 on our communities of color. We heard that nationally, statewide, and again, St. Clair County is no different. Those who are Black or African American had a higher case rate of COVID-19, 11% higher cases of COVID-19 in our Black or African American residents over our white residents. We also know that was case rates. So when we look at death, we know that age is just the most significant factor. Once you're at 70, your risk of death from COVID-19 increases, and when you're at 80, it almost triples there too, because of health conditions, maybe comorbidities, those kind of things. We also know males had a higher death rate than females disproportionately as well. As far as those in our communities of color, statewide, we know the governor put forth a task force right away to address that and kind of combat those effects in what we're doing. We also work locally, met weekly with our St. Clair County Better Together diversity group on how to reach those populations with testing, vaccines, where are we hosting clinics, those kind of things. So we're still working with that group and how to get everything out appropriately and reach everyone.
Okay. And then lastly, since the start of COVID, there's been a lot of information and research conducted. As a society, we've learned a great deal about this pandemic, and I wondered, is there anything new regarding this that you believe our audience would just benefit from knowing?
Right, well, that's an understatement, right? The amount of research that's been done on COVID and everything we've learned just as general non-medical society probably is information overload. But new things that are out there, I think most importantly is that we know that COVID-19 has not gone away. We hear a lot of people in the community say COVID-19 is over. COVID is not over, the pandemic is over. Right, the pandemic declaration, that is over. COVID-19 is still something at the health department. We work on individual cases. We've worked vaccine into our just menu of vaccines that we offer. We all know the medical countermeasures, the steps to take. So COVID-19 is not over. We will still see spikes in cases, high points, low points. We still have to follow those measures to mitigate those things. Also a big thing that's going on right now that you're going to hear about in the next month is the commercialization of medical countermeasures, which means we're going from that government pipeline of the government takes the contract for vaccines and testing kits and antivirals, and we were allowed those things at no cost. That's now moving to the private side. What that means is that, so we, like as a health department, will purchase the vaccine just like we do any tetanus vaccine or hepatitis B vaccine, and we will bill insurance for that vaccine. We're going to work very hard at making sure we're equitable in that distribution as well, and those who are uninsured and underinsured still have access to the vaccine. So there will be programs coming out to offer that at low or reduced cost as well within our community through the health department, through our federally qualified health centers, and possibly pharmacies. The other thing you're going to see is that the vaccine composition is changing. And we know this has happened throughout the pandemic, that the composition changes and is supposed to match what's going on and what's circulating in the community. So the composition is changing right now. That new monovalent vaccine will be out, we're hearing mid to late September. I'm hopeful that that'll be the time frame, but we know how things have rolled through this, and it might be a little later. So I guess just stay tuned for information from the health department on that.
Okay. That is great to hear. And you talked about the community health needs assessment and some of those things. And as a person who likes to look into those numbers, and it really matched with some of the stigma work that we do in the community, it really showed of interest that binge drinking population was not where the stigma often goes to. It's the person with a substance use disorder. They look like this, they act like that. But really to see it in that was college-educated white males with an income greater than $75,000 was the highest rate of binge drinking in our community, which is, and Wyatt, you can't even mention that, fits to yours when you could legally go to the bar, and then like that part that drinking just spiked. So it was really interesting to see that one, which when you take this look at it, it really, I don't want to say normalizes, but humanizes and shows the diverse impact that substance use can have on anyone.
Right, those impacts of the stresses we were feeling, you can see that now in the data that's there. And I think what also I want to mention is that we're working on solutions, right? From that information, we work towards the community health improvement plan, and the stakeholders are getting together, and we're working on those solutions like the naloxone and increasing that in the community. So that hard work is being done as well.
Yeah, thank you, Liz, for
welcome.
all the work that you and the health department have done during the pandemic, and all the, like you mentioned, the ongoing work that you guys do. Public health doesn't stop.
No, it doesn't.
It's appreciated. Up next is Alex Allen. Alex is a school resource officer with the Port Huron Police Department. So welcome to the panel today, Alex.
Thanks for inviting me, Ken.
Absolutely. So as a school resource officer, what changes have you seen in our local high school students since post-COVID, especially in relation to mental health and substance use?
So last year I was assigned to the St. Clair County Community College as a resource officer there. But I've been dropping into the high schools, filling in for our other SROs when they're off. So some of the stuff that we've seen is, high school, it's just a smaller, representation of the community at large. The students, they're out there in the community when they're not at school. So we kind of expect them to represent what's going on. So like it was mentioned, they've been an increase in e-cigarettes and vaping, just different mental health issues with the isolation, going back to, virtual, not having school, in person, virtual, just bouncing back and forth, and things of that nature.
So you saw some of those similar impacts of the
Yes, very
tobacco,
similar.
and then even the
everything.
isolation that Wyatt mentioned.
Yes, everything that we've been seeing out in the community. Also, with marijuana being legalized, we're starting to see, like THC coming into the vapes, and some edibles, but nothing, I wouldn't say any more than what we're seeing before.
Okay. So working in our local schools, you said the community college, and then also spending some time in the local high schools. How do you, as a resource officer in the Port Huron Police Department, how do you guys support those youth that you see that are struggling?
So we follow the National Association of School Resource Officers. They call it the triad model. So the first one, like that most obvious one, we're law enforcement officers. We handle like the safety and security in the school. The other two, though, being an informal counselor and a mentor to the students, trying to build a rapport and a level of trust that we're approachable. They can come to us if there's a problem. It doesn't automatically mean that they're making a police report and it's going to go towards the police side of things. The other one is being a public safety educator. So we get asked to come into a class and give a presentation about vaping and the harmful effects. Some of the penalties could be about driving, or any other topics have to do with public safety, but vaping and drug use is one of the ones that we do get asked to come in and talk about.
Okay, so kind of even as you mentioned, Wyatt, if someone's in that spot of struggle, creating that relationship with the police department, that we aren't here just to enforce laws, there is that other side that your public safety involves help, involves, as you mentioned, mentorship. So knowing that I can reach out to an officer and it's not in that punitive form, but it's in that helpful form.
Yes.
Okay. So with that presence that you have in the schools and kind of being, again, a different kind of adult eye on the youth of our community, what positive things have you noticed or seen implemented that are being helpful to the students?
So just a quick example, whenever I filled in for one of the other school resource officers when they're not in the building, the first thing that I get asked is, where's officer so-and-so? Where are they today? And, I might tell them, I don't know where they're at, or they're at a doctor's appointment, they'll be here later. But just seeing the level of trust and, the rapport with the students that we've been able to, get to, they really value it and they look for it constantly. And then also with the school administration, I know we have officers that work with, the Odyssey House and the Mort team. Just having all those resources available that we can pull from, even outside of the school. So if somebody was to come to me, I know that I could call, the community mental health. I could call somebody that would have a resource that maybe the school wouldn't have had if we weren't there.
Okay, so even using your connections as an officer within the community and the community partnerships to really find those programs that, again, support the community, but also, as you mentioned, the students in general, if they're struggling.
Yes.
Okay. So we often hear about the things we don't do well. We have that negative spin often on things. What are some examples of things that our community as a whole can do to better support students overall? How can we help those students in the schools?
The students, like when they're looking for something outside of the school hours, I think, parents need to be willing to, call and look for something, get them the resources they need. Sometimes, they say that they'll handle it themselves. I think if they look for those resources, though, they don't have to do it themselves. And if we make those resources, more widely available or more, publicized to them, if we're not, just knowing that they can reach out and get some help with handling those problems.
So almost the admission that your child is struggling sometimes, that to listen to your kids when they say that something's going on.
Yes.
And to use, kind of as you say, those professional resources that are out here. So, and I will add on that one that's a commonly unknown item is that in the state of Michigan, the age to consent for what we call behavioral health, which is your mental health or substance use treatment, in the state of Michigan, it's the age of 14. So for a child, and that's, you're looking at the 9th grade range, those high school students, if they felt the need to reach out, they can enroll themselves in services. They can find a counselor for mental health. They can find a substance abuse counselor. They actually have the right to consent to those levels of treatment. So I think that's a good resource sometimes for folks to know, that it doesn't always have to actually even go through the parent. You can enroll in the services, and obviously community providers work with the family as a whole, but the child can actually initiate that treatment. So thank you, Alex, for joining us this morning and your work really in keeping our students and faculty safe.
Thanks.
At this time, we are going to take a quick moment to see if there are any questions for the panelists. And again, I absolutely thank you guys for joining.
Yeah, you're welcome. Thank you.
Thanks for having us.
All right. Wyatt, we have a comment in for you. Just an absolute thank you so much for sharing your story, and that it's very powerful. And those stories of lived experience, just by being you, and doing what you've done is, as we hear, very powerful. Another comment from an individual saying that this has been very helpful. So again, I don't think you guys needed a reason to come, but our community is absolutely appreciating it as well. Wyatt, we do have a question in for yourself, and it's, what do you do personally to help you stay sober?
I don't know. My days are crazy. I own an excavating company, so everything has changed on a dime. So, but I usually get up pretty early in the morning. I get right, just take a moment by myself and talk to God and get right, and just stay positive throughout the day and say it's a good day. It's gonna happen, even though if something bad does happen. You You got to tell yourself it's great, it's a good day, it's going to happen, I'm okay, I'm this. You talk to yourself positive, you're going to think positive and walk positive, and you're going to have a positive atmosphere, feeling about yourself. If you're negative, stinking thinking and this and that, it's contagious, and then you're going to act that out. But yeah, just staying positive and just trying to be a husband and a man of God and just a business owner, and also trying to stay sober. It's one day at a time, really,
So very busy.
Very busy, yes. I am very, very, I got 5, 6 things going on all times. Busy, very busy.
So boredom, avoiding boredom, and then I hear you say
Yeah.
kind of setting that positive tone from the start.
100%. That's where it starts.
Awesome, thank
Yeah.
you. Alex, what do you feel that a parent should do if they suspect that their child might be using either alcohol or cannabis or even vaping? What recommendations or advice would you have for the parent who may be concerned for their child?
Well, what we see a lot of times, parents will call and they'll say, I'm not sure if I'm allowed to look through their stuff, or I'm not sure if I'm allowed to take things away from them. Like, well, you are allowed to do that. And, the parents, you're really the best position to handle that. If you feel that you need to call the police, you absolutely can. We're more than willing to help with that situation. But a lot of times all we're doing is just, reassuring the parent that they're doing the right thing and, providing some resources, but also talking to the youth and kind of explaining to them that, yeah, your parents can put these, systems in place. They can take your phone. They can, go through your stuff.
Your parents can parent?
They can parent you, A lot of the kids don't necessarily understand that.
Okay. So really just, I hear that again, that reinforcement that for the parent that you're doing the right thing. Having to call us is not a sign of weakness. It's not this thing that you failed as a parent, but so reinforcement, and then also reminding those kids that, structure, rules, and those things, as much as we may have hated it as an adolescent, they exist for a reason.
Yes.
Perfect. Thank you all. We appreciate the questions from those in the audience as well. We're now going to have a couple-minute pause in order to make room for our next panelist. So again, thank you all for joining us, and I will give you your days back.
Yeah.
If you in the audience there want to take a moment for yourself, we will be back shortly. Thank you again for joining the St. Clair County Virtual Town Hall on substance use in our community post-COVID-19. Today's event is being brought to you by the Community Services Coordinating Body's Substance Use Prevention, Treatment, and Recovery Work Group, with today's funds being provided by the Michigan Department of Health and Human Services. We do hope that today's town hall provides you with a better understanding of how substance use has changed over the last few years here in St. Clair County. And if you or a loved one need more information about available resources within our community, please go to www.cscbinfo.org, or you can reach out through the CSCB Facebook page where this is being live streamed today. If you need access to treatment, please call the Region 10 Access Line at 888-225-4447. Welcome back, and thank you for continuing to join us. Reminder, if you do have any questions, you can throw those into the chat and comments. We'd like to welcome our next guest. This is Melissa Hunt. Melissa has worked at St. Clair County Community Mental Health for the last 16 years, and she has an extensive background in working with teens and families facing challenges regarding substance use concerns. Welcome.
Thank you for having me.
So, from a clinical perspective, what changes have you seen post-COVID in relation to mental health and substance use?
So we've definitely seen a large increase in people requesting services. We've seen an increase in co-occurring disorders in regards to anxiety and substance use, depression and substance use. The pandemic affected the public's mental health, in all sorts of different ways, from isolation to loneliness to job loss to financial concerns, illness, grief, and just the uncertainty of what's going to happen next. And so people are still really struggling with that, what's going to happen next. And so, we've definitely seen an increase in reported substance use and people seeking out our services. Some of the things that have come out of the pandemic being positive, though, is we've added telehealth services for people. We've had an increase in services overall. The schools have implemented the school resource officers. We've seen a lot of programs come out of this. So there are some positive things that came out of it, but definitely because of the need for people's mental health.
Okay, so there were some things that were maybe pushed forward that maybe could have existed, like telehealth before, been better utilized. So finding some areas of again, positive.
Absolutely.
So you mentioned that a lot of folks, it appears, may have turned to alcohol and drug use as a way to cope. What are some healthy ways for someone to deal with that anxiety, depression, loneliness, or maybe some of those other issues that came up?
Sure. So some of the things, one of the biggest things I always say is having a supportive system around you, whether that's friends, families, groups that you may join. Definitely sleep hygiene, making sure that you're getting enough sleep, you're getting good sleep, that you have a healthy diet. We know that impacts our mood. Not using drugs and alcohol, obviously. Mm-hmm. Getting into therapy, there's no shame or stigma to being part of therapy, being in groups, positive social groups, accepting that you can't control everything. Sometimes we just can't control what's happening, and we have to accept that. Getting involved, kind of just being kind to yourself, reminding you that it's okay to make mistakes, it's okay to be okay with that, and humor. Absolutely, using some humor is a healthy way to cope with life.
Humor is a huge one for self, and I'll absolutely agree on that one. And it was an interesting one. I had heard the main feeling that many had in COVID, it being identified as grief, and looking at it through that kind of, I'm lost, I'm confused, and I don't know what to do lens. So
Yeah.
So what are some signs or maybe some things that maybe I should look for in others to indicate that maybe there is an instance or an issue with substance use? What should we look for?
Yeah, so some things for people to look for, like changes in behavior. Suddenly the person, they're no longer involved in what they used to be involved in. They no longer come to family gatherings. They have a different group of friends. They may be sleeping too much or sleeping too little. They may be eating too much or eating too little. Risky behaviors, things that they just didn't do in the past. So things that really, this is the norm for this person, and now suddenly this is not the norm. They're definitely missing work, not going to school, and really being secretive. Sometimes, you just don't know. You ask what's going on, they're like, just get away, I don't want to talk to you. So those are definitely some things that would be some cues to missing money.
So they're not themselves.
Yeah.
There's just been that real shift, and they were like this, and now they're. So that kind of is a signal that something's happening.
Yeah, absolutely.
Okay. We often hear that mental health and substance use are related or tied together. Can you better maybe tell us a little bit more about that connection?
Sure. So, yeah, it's kind of, was it the chicken or the egg that came first, right? But they really do kind of go hand in hand. And so if I'm suffering from anxiety, if I'm worried about what's going to happen next, I might turn to alcohol, I might turn to marijuana, I might turn to drugs to self-medicate and keep that, so that I can try and function, or at least look like I'm functioning. So they definitely go hand in hand.
Okay, and it is, I believe you used the word, is that the co-occurring that you kind of talked about, where an individual is managing or dealing with both of those things at the same time?
Correct, yes, that is, and that is a situation where, it's hard to tell, is it the anxiety that's causing, the drinking, or is it the drinking that's causing the anxiety? So that's when we're working with both things to help the person get through that, through therapy.
Okay. Thank you for that great information, and then all of the work you've done throughout our community with, teens, families, and your role at Community Mental Health.
Thank you. And if someone is seeking services through us, they can call 888-225-4447. And if they were in an emergency situation where they needed mental health services right away, they could speak with somebody at our mobile crisis unit also at 810-966-2575.
Okay. Perfect, thank you. Our next guest is Patrick Patterson. Patrick is the Executive Director of the Blue Water Recovery and Outreach Center, or BW ROC, and is also the Vice Chair for the State of Michigan's Opioid Advisory Commission. Pat himself is also a person in long-term recovery. Welcome, Pat.
Thank you, Ken.
Is it Pat or Patrick? I never know.
Patrick.
You go back and forth, right?
Patrick.
Patrick, perfect. So we've mentioned it a few times today, and we know that stigma exists around addiction. What are some ways we can work on changing that stigma associated with substance use?
Sure, great question. I think at the heart of every organization, at the heart of substance use and recovery, and at the heart of a community is people. And people can change, and people can recover. We can't get caught in the trap. I see it happening with organizations. I see negative stigma, negative comments being made about people in recovery or just this organization or this community, and I can't get caught in that trap. We have to believe in hope that tomorrow is a better day than today is, and I have to take action in order for me to get there. But so I think at the root of the problem in the solution lies in one addict helping another, and our community embracing that addiction exists, and two, the solutions rely in a community and people rubbing shoulder to other people. Addiction's a disease of isolation. It's very easy for me to sit at home and take the easy route out, and there's a difference between recovery and sobriety. Staying home and sitting on the couch, not drinking, is being sober. Changing my environment, going out journaling, taking a walk for the day, meeting with a recovery coach, going back to SC4 for schooling again. That's recovery. That's improving my life, improving our community, and as a result, we're all going to be better. And I think stigma also is more than just a billboard, right? Stigma is, we had 8 people march in the parade 5 years ago, and this last year we had over 100. So our community actually has accepted, to an extent, SUD farther than where we were at 5 years ago. So we've had stigma reduction. If we go into counties next to us in northern Michigan that are more rural, they still have a big, stigma plays a big role in those communities. And SUD, or substance use disorder, and recovery and addiction still lies in back alleys. So we've come out of that. Organizations have worked in a better capacity to help one another, and we still have a long way to go. Mm-hmm. We can't quit now, but we're certainly went arm in arm with each other, and the more we can do that, the better part we're going. I mean, we all have to take ownership in that. Bettering our world applies to all of us.
And I hear some great points that the word you mentioned, people, community, and then the power to be able to stand up and be who you are. Be that a person in recovery, be that a person who's struggling, being not afraid to walk through downtown in a parade because you don't have that fear of the judgment upon you. So hearing some of those things is wonderful. Can you share briefly what's available in our community to assist those individuals with a substance use issue?
Sure. Another great question. St. Clair County has a lot of resources for somebody struggling with SUD or somebody seeking recovery, but I have to get outside of my box, and I have to understand that they're there. I have to have the willingness to take step one. So we have a lot of resources now. What we don't have is an inpatient treatment provider, but what we do have is the long-term aftercare recovery plan. Again, that still has a long way to go, but we've got Port Huron Odyssey House, and I want to credit Ken and the organization that he represents and works for, that they put 10 naloxone kits outside in our community for somebody looking for a quick Narcan kit. We have our local CMH, Sacred Heart Rehab, Renewal, Colonial Woods, Catholic Charities, BW Rock. We have a big 12-step community. The Dry Dock offers support groups there. We've got Region 10 Access Line, Operation Transformation, and they do a great job helping with their faith-based mentors for those looking for that. And we also have a community help card. So there's a lot of local resources, but again, I have to have the willingness in order to get there and take step one, and that takes ownership and understanding the role that I play in my own decisions and understanding the role that I play in my own addiction. If I sit back and just blame other people, I will not get to these resources. But the sooner I understand, when I look at the lens of saying somebody in active addiction and somebody with years in recovery, they have an attitude difference and a behavioral change of humility, walking with grace, understanding that here's the role that I played in this. This is what I did in order to help myself. If I have too big of an ego, if I can't get to that point, if I'm arrogant, those, behavioral traits and recovery don't walk together.
Mm-hmm. So I hear you saying that we have a lot of things to sustain and hold up someone in that long-term recovery. And then you took that first part that as people in long-term recovery or those as professionals, we may know all about it. But hearing that it's there, and then you said taking that first step. So what is a great way for someone to either find out about or connect, to these great resources that we do have?
Sure. So there's a lot of numbers out there that you can call. Easy ones are the 211 line, 911, and other organizations. BW Rock serves as a big community navigator. So they're a central place on 10th and Lapeer that offers, a conduit to a lot of other support systems in town. CMH, Port Huron Odyssey. You can go to the bwroc.org, click on resources, and in there will be a Google Map section of all the local resources with the local community meetings. So you need a 12-step meeting, you need Recovery Dharma, you need a faith-based route, whatever meeting you need on that particular day, you can find on that local resource page. So there's a lot of resources out there. Again, Odyssey, we want to credit Odyssey and all the recovery houses that we have in town, really pulling together. This is a really good community for somebody that is looking to recover.
That's amazing. So I hear you saying that within that community or recovery community network, that group of folks who are actively trying, we have good support. How can the community as a whole, how can the people of St. Clair County effectively support someone seeking recovery?
Sure. It's a great question. I asked the staff that question earlier today to help me along, and what helped their journey. One gal responded with the community loving the individual. That hope goes a long way, and when I don't feel I have hope, that's a dark place. And so when one neighbor helping another neighbor and that sort of giving goes around, tell me you're not going to feel better inside your heart. And when my heart feels better, I make better decisions. Believing that we do recover, believing and seeing that not only do we recover, but we become productive members of society again. And I think as soon as we all embrace that, that's an attitude and a mentality that our community has, that we are all in this together, and when we embrace it, we will become better as a society and a community.
Okay, and that's, I hear that word again over and over in community, which is made up of people. And that humanization, that understanding that the person struggling is my neighbor, is my former classmate, is the parent of my children's classmate. They are people that are in my community, and if I'm not supporting and helping our community grow, am I actually in turn then hurting it? So really that uplifting part. I want to thank you again, Pat, for all the work you do at the state level and then also here in St. Clair County with BW Rock. So thank you for all that good resource information.
Thanks for having us on. Big shout out to our staff and all the people that are out there trying to help one another. They are a very passionate group of individuals and very helpful.
Perfect. And then our last and final panelist is Amanda Bellata. Amanda is another person in long-term recovery, and she uses her personal experience and passion as the lead peer recovery coach for the Michigan Department of Corrections Recovery, Advocacy, and Program Supports Division for individuals that are currently on probation or parole. Do I have that right?
You do.
All right, there's a lot of acronyms
Yes.
and letters in there. MDOC wraps.
Yes.
But no one knows that. So welcome. And then can you tell us a little about your experience going from using to being a person in long-term recovery?
So that looked like utilizing a lot of support, a lot of resources, and having the willingness to do so. I found recovery through a lot of pain, which I think most people can identify with that are on this journey as well. So it's a great motivator for most of us. I was the kind of person who was very determined to figure out how to successfully use drugs and alcohol, but I didn't, obviously. But along that journey came trying things my way, trying treatment centers, being in different institutions, jails, all of the things, and getting to a point in 2016, and this day is great to be here, especially my husband lost his battle to an opiate overdose, and I was facing CPS and foster care involvement because I was in jail when it happened. And that was really the moment that I realized I was going to give my entire life over as I knew it to continue to use, or I was going to try to fight and maybe take some of the suggestions I had heard from people that had made it out to the other side. So today I dedicate my life to do that for others, not only in this program, but as a person in recovery, to just never give up on people and connect them to the community supports that are available to help, because that is what helped me.
Okay, that's an incredibly powerful story, as well as Wyatt's was earlier. So what would you say is kind of that daily motivation to maintain your recovery?
So there's a lot of motivations. As you go on in your recovery journey, you gain more reasons to continue on. Being a mother today, I just got remarried, so being a wife, and doing what I do, and really turning my pain into some purpose is my greatest honor. So my husband and I did not experience recovery together, unfortunately, but if I could help one person go home and be a father or mother to their child, that is the greatest living amends that I could do for him and the greatest honor. So I'm extremely passionate about that, as well as now leading a team of coaches who are in 13 counties throughout the state of Michigan, and the ways that they're pouring into individuals who are under felony supervision, and showing them that there's another way out.
Okay, and I'm going to give you a pat on the back for that one, as we have in the past. So 3 counties were piloted. I believe it was us, St. Clair County, Washtenaw, and then what was the third?
Saginaw.
In Saginaw County. So it was a pilot program that you helped bring here.
Yes.
And then because of those successes of yourself and those other counties, it's expanded to 13. So
Yeah.
again, you say turning the pain into purpose. It's a huge thing you've brought, not just our community, but then showed really the state is effective. So congratulations on that part, and then also the recent marriage.
Thank you.
So overall, how did 2020 and since then that COVID pandemic, how did that affect or impact your recovery?
So as Wyatt and I know everyone knows, it was huge. It incited fear into the world as we know it. It changed so much. So in recovery, I guess there was silver lining in it in some sort, because it opened up this virtual world. And so suddenly, when I started my recovery journey, it was pretty traditional. There's multiple pathways to recovery. So I found through the 12 steps, I learned to have a reliance on a higher power. And that was such an important lesson, because when COVID happened and then people were removed, you're really left with the tools that you have available. So digging deeper into that, securing my connection there, and then exploring what else I was interested in virtually. So, there was SMART recovery meetings, there were 12-step meetings, there's the Dharma meetings. You could find anything 24 hours a day, basically, online, if you were willing, again, to explore. So another neat thing about it was that instead of just being in St. Clair County only with people in recovery, it expanded our horizons into different counties and even different countries. So that was kind of something different, going to a meeting in Ireland, and just just simply for the accents or whatever. But that was an interesting part of COVID that luckily we have to take with us today in the recovery world, and help people utilize supports if they don't have transportation or whatever.
So it was that part, as you said, it almost strengthened it,
Yeah.
almost through challenging it. Because what we heard often anecdotally was, for some, they found their recovery may not have been secure as they had thought. And then for that, as you said, those willing were able to move forward with it and continue to grow. So same kind of thing with Wyatt. So lastly, what advice do you have for someone who is still struggling with use?
So don't stop trying. I'm grateful I didn't, and there's going to be a time that you'll try for the last time, which is a beautiful moment. And if you want something different, you have to do something different. I think that's one of the bigger ones. So that means you may need to leave the environment you're in. You may need to do some uncomfortable things you're not really wanting to do, but if nothing changes, nothing changes.
Okay, that's awesome. Thank you again, Amanda, and then again, congratulations on all of your accomplishments throughout your recovery. We'll pause once again to see if we did have any more questions from the audience for our guests. I got a lot more this time. Holy comments. All right. Some of the comments again, and we want to thank you that have taken your Thursday morning to join us. And then communicating with us that, this part, that support is crucial. Is coming in from them, that having that either community support, family support. I think all three of you mentioned that part, that it takes more than one. Again, just some generalized comments of thank you all so very much for what you do. Grateful for our community. Pat, someone out there is at least letting you know that BW Rock saves lives. And I know that at times hearing that or getting the impact that we know it works is super helpful. And then this other part again is it takes a village. It is not one person's job to recover the community. It's a community's job to heal a community. Amanda, you are a true inspiration sister. So whoever out there has you as that true inspiration. Question for Melissa. Can you talk about some of that virtual therapy, maybe what it is, how a person can maybe get connected, and a little bit more about that virtual therapy you mentioned?
Absolutely. So we have specific telehealth therapists at CMH, and we have our therapists have the ability to do telehealth. So if someone is not able to make it to us, we make it to them virtually. And so back to the access line number was the 888-225-4447. They would do an intake, and then from there, once they start talking about what they'd like to do, then we could offer the virtual therapy. It is on a HIPAA compliant platform, and it's just a link. It's easy enough to click. You can do it from your phone.
So video, telephone, or both?
Video, yep, it's
Okay.
video, yep. And so they can see the therapists can see them. We offer all types of different therapy that way. They could join into a group through our platform also. So if they wanted to be, we have DRA groups, and so they could join in with that too. And our peers have that ability, our case managers and our therapists, so.
Okay. And then really for any is, so how can a person in the community help fight the stigma associated with that substance use and mental health, either as a person in recovery or with one, or just how can we help break down that barrier?
I think, and somebody else can join in too, is just involvement. When I'm not involved, I'm not reducing anything to do with stigma. But when I come out of my shell and I show up at community events, either side by side with an organization in recovery, you guys cooked hot dogs a month ago, right? So I'm not doing anything at home. I'm trying to figure out how I can help. Show up there. Get to know your neighbors. Get to know the people that are trying to recover, and give them some words of encouragement. If nothing changes, nothing changes. But as you mentioned earlier, we're all in this together. It takes a community, it takes a village, and it takes an army.
So being involved, being part of.
Yes.
And I think that piece of support, knowing someone is standing next to me, that isn't going to push me down. Even if I can't lift you up, I don't have the resources to, I'm there, is helpful.
Well, taking ownership and trying to improve my neighborhood. Sitting back and complaining that my neighborhood's no good isn't making the world a better place. I have to come outside and I have to sweep the sidewalk. I have to shovel it in the wintertime. I have to mow my lawn. I have to be a part of the solution, not just complain about the problem.
Okay. And then a question for you, Pat. Are you able to share maybe some of the more specific types of groups or maybe recovery meetings that we have here in our community?
Sure.
Name them all. We're going to.
There's 30. I want to say that there's 33 or there's 30 some meetings every week that exist in our community. Most of them are 12-step based, AA, NA. A lot of those exist at churches, BW Rock, the Dry Dock downtown. You can go to bwroc.org, click on resources, and then local support groups, and you'll see the list come up of AA meetings, NA meetings, and local support groups in town.
Okay. And then, Amanda, I heard you mention kind of some others. I think it was, I heard a DRA, a Dharma, a SMART, so maybe a quick
Be
synopsis
more
of what some of
specific,
these are.
on Tuesday nights at more specific, got it.
Yep.
6 o'clock, Recovery Dharma. On Tuesdays at BW Rock. On Thursdays is Life Recovery Bible at 6:30. On Sundays is AA at 3 o'clock at BW Rock. Again, I couldn't go through all 30 of them right now, but
Yep.
that's just to highlight a couple of them.
So it was that part. There's the 12-step traditional that many know of, and then you said some of these multiple for either, are they spiritual based? I've heard some are.
Some are, some aren't. There's secular based as well. There is MARA meetings for medicated assisted recovery. There's codependency meetings. There's all different kinds of pathways. So I think oftentimes people are sometimes led to one and think that's the only one, but I've learned on my journey in recovery that our pathways change, and sometimes it's the gym, it's yoga, it's spirituality, holistic approach. There's all kinds of ways to do this.
So there are lots of opportunities,
Yes.
and as you mentioned earlier, Pat, it's the willingness to take that first step to come out and join this community that is existing around you. So that is wonderful. With that, we'll look to conclude today's virtual town hall on substance use in our community post-COVID-19. We absolutely hope that today's discussion provided you with new insights into what is going on in our community to help support our friends, families, and neighbors that are dealing with mental health and substance use concerns. We do want to thank the Michigan Department of Health and Human Services Substance Use, Gambling, and Epidemiology Division for providing funding for today's conversation. We also wanted to thank the St. Clair County CSCB Substance Use Prevention, Treatment, and Recovery Work Group for their work in putting together this event. Obviously, we want to thank all of our panelists for providing us with your knowledge, your time, and of course, we also want to thank you, the audience, for spending your morning with us on this International Overdose Awareness Day. If you want to learn more about the CSCB or any of the work groups associated with it, please head to their website at www.cscbinfo.org. A recording of today's town hall will also be available on their website in the near future. Thank you again, and we ask that you continue recognizing those people who go unseen.